annual Triage conference, and that's our second day in webinar format, which is due to COVID. This last year has been a very challenging one for all nurses, and no less so for nurses who work in telephone triage. Our skills in assessing patients over the phone have been invaluable. COVID risk assessments, referrals for COVID testing, and even contact tracing has become the new norm on top of our usual patient assessment. Remote assessment is now widespread, with many hospital departments carrying out a telephonic assessment on patients prior to admission, and GP surgeries also carrying out remote assessments and prescribing. In triaging patients, we've recognised new trends and symptoms in COVID even before they were recognised officially. We've also observed patients become more anxious than usual as we've continued to advise them, despite their concerns in going to hospital or sometimes even leaving the house to see a doctor. Did we ever think we would see the day patients would not want an appointment to see a doctor or have a doctor called to their home? Prior to COVID, we would have laughed at the idea, but these are different times. We've all faced challenges in our personal lives also. Some of us have contracted COVID or continue to suffer the effects of long COVID. We've endured long separations from loved ones, had children schooled at home, and missed out on many of life's usual rites of passage and occasions. But despite lockdowns and restrictions, we've continued to do our job. We recognise the importance of the work we do and the need to keep ourselves updated. Like last year, we were determined to go ahead with our annual conference. And with the support of our section officer, Jean Carroll, we are here connected online for today's webinar. Our speakers today will talk about subjects as diverse as COVID, rashes, endoscopy, inflammatory bowel disease, the menopause, cancer treatments, and mindfulness. And I hope you'll enjoy it. To open our webinar, I would like to welcome our current INMO President, Karen McGowan. She's a registered ANP in the Emergency Department at Beaumont Hospital, trained in Beaumont, and then completed her Bachelor of Nursing Science at DCU. And additionally, she serves as a local nurse representative. Thank you, Karen.
Thank you, Hazel. Thank you very much. We are delighted to welcome you all to our telephone triage webinar this morning, and I am honoured to be opening this webinar, and hopefully next year, as Hazel has said rightly, that we will be meeting in person. Today would not be taking place only for the huge dedication of our planning committee, who have put many hours into ensuring that you have an excellent programme for today. I would like to thank INMO Professional and Jean Carroll for her hard work and dedication to section development, and as Hazel rightly said, we'd be lost without her. I would like to quickly take this opportunity to specifically thank the Chairperson Hazel James, Vice Chairperson Fiona Kennedy, Secretary Ger Byrne, and Education Officer Edwina Comerford. Next slide. So COVID-19 continues to impact on our lives as we now enter wintertime. Nurses and midwives have been and will continue to be at the forefront of delivering compassionate care that has demonstrated commitment to individuals and also wider society. Nurses and midwives have shown the courage to care in often very difficult circumstances. And as you know, the INMO are pursuing a claim for compensation that is ongoing at the moment for the work done by our members during this pandemic. However, it is also vital that the physical, psychological and emotional impact of COVID-19 is recognised and action is taken to support nurses and midwives. Telephone triage nurses have been to the fore in providing services across Ireland in often quite difficult situations. You have been the reassuring and knowledgeable voice in these very difficult times. We recognise the contribution that you and your colleagues have made to the nation during this pandemic, and more generally, we thank you most sincerely for that. Technology during the pandemic and the use of e-health and telehealth has increased and become widespread. A recent survey shows great patient satisfaction of 88% rated outcomes from virtual consultations as good or as better than expected. However, this needs to be supported and robustly tested to ensure that the technology is ready to evolve with health services needs and demands. We will be there to support you as you are the driving force behind these advancements to practice. This will ensure patient safety and enable individuals to have access to evidence-informed practice and care. And as you all know, these are the main core values of the telephone triage section. Your role is essential, and so too in that regard are the discussions that you will have today. Next slide. Today, we are pleased to be in a position to share with you a wonderful lineup of speakers. We have Professor Luke O'Neill, who is the Professor of Biochemistry in the School of Biochemistry and Immunology in Trinity College Dublin. We have GP Caroline McMonigal, Fidelma Lindsay, who will be discussing all things endoscopy related, Yvonne Bailey, who will be discussing irritable bowel syndrome, Carmel O'Keefe, who is a wonderful clinical nurse specialist in oncology, and Teresa Lowry Lennon will be discussing menopause. We will be finishing off mindfully with Aparna Shukla, who specialises in mindfulness. So thank you for your attention this morning, and it gives me great pleasure as your president to formally open this webinar, and I will now hand you back to Hazel James, your chairperson for this morning's session. Thank you, Hazel.